Some advice came out recently about parents still taking their children for diabetes testing if they feel like they have symptoms. The fear is that maybe children won't be getting tested because of obviously what's going on with the coronavirus pandemic.
You know that there's an awful lot going on in society at the minute and an awful lot of pressures on the NHS. Lots of advice about not going to GPs, not going to hospitals. But that's made us really a little bit concerned that those people who may be experiencing new onset diabetes won't recognise the symptoms and may not do anything appropriate for it. Over England and Wales, we know that around 23% of children and young people develop something called diabetic ketoacidosis, or DKA, when they are first diagnosed. Now that is a really acute complication that is potentially life-threatening. So we're urging parents and loved ones or anyone that recognises the symptoms of type 1 diabetes particularly to really get some action and go to the hospital. We talk about the 4 classic symptoms of type 1 diabetes, and we call them the 4 T's, and that's going to the toilet a lot, getting thinner or looking thinner, being more tired than usual, and being very thirsty. So all of these are very classic signs of type 1 diabetes in children and in adults as well. So although type 1 diabetes is the most common form of diabetes in children and young people, nobody's really immune to it, and we can develop it at any age. Ultimately, we want to remind people that the NHS is still open, that new onset type 1 diabetes is a medical emergency, and people need to access either their GP or in some circumstances, accident and emergency departments in order to get that life-saving treatment.